Dental fillings are a common procedure used to repair cavities and restore the integrity of a tooth. However, many people experience discomfort or pain after getting a filling, which can be concerning. This pain might be immediate or develop over time, leading to questions about whether something went wrong during the procedure or if it's a normal part of the healing process. Understanding why this pain occurs is crucial for ensuring proper care and avoiding unnecessary worry. In this video, we'll explore the reasons why a dental filling might ache after the procedure. Pain can arise due to a variety of factors, such as sensitivity to the materials used in the filling, the depth of the cavity, or even the bite alignment after the filling is placed. By identifying these potential causes, you'll be better equipped to understand your symptoms and know when it's necessary to seek further dental care. One of the most common reasons for discomfort after a dental filling, particularly with older fillings like amalgam, is the development of marginal leakage. Over time, a gap can form between the filling and the tooth due to differences in their physical and mechanical properties. This gap often goes unnoticed, but can become a trap for food particles and liquids, leading to complications. As these substances accumulate, they create an environment where bacteria can thrive, eventually causing secondary caries. When secondary caries develop, the decay can progress toward the tooth's central portion, known as the pulp, which is highly sensitive. This can lead to significant discomfort and pain, particularly when eating or drinking. Patients with such issues often report a persistent ache in the filled tooth, which can be a sign that the filling is no longer effectively sealing the tooth and may require replacement or further dental treatment. Sometimes, the pain after a filling can be directly related to the type of material used. For instance, composite restorative materials, which are popular due to their natural appearance, may not be suitable for deep cavities. These materials can leach acids over time, leading to increased sensitivity, especially in deeper fillings where the material is closer to the tooth's nerve. This sensitivity can manifest as sharp pain when consuming hot or cold foods and drinks, making the filling uncomfortable for the patient. In cases where the cavity is deep, glass ionomer fillings are often the better choice. These materials are less likely to cause sensitivity as they release fluoride, which can help protect the tooth from further decay. However, when the filling is needed in a front tooth, aesthetics become a priority, and composite fillings are often the only viable option due to their ability to blend seamlessly with the natural tooth color. In such scenarios, while composite fillings are preferred for their appearance, careful consideration is needed to manage any potential sensitivity. In some cases, cavities are so deep that they extend into the pulp of the tooth, which is the innermost and most sensitive part. When this happens, a root canal may be necessary to properly treat the infection and prevent further complications. However, if a patient insists on having a filling instead of a root canal, and the dentist reluctantly complies, the outcome can be problematic. The patient may experience severe pain after the procedure, and in some cases, a large swelling can develop. This is because the infected pulp continues to produce fluids that accumulate in the pulp chamber, which is a confined space. Normally, when the pulp is infected, the decay creates an opening that allows these fluids to drain into the oral cavity, relieving some pressure. But if a filling is placed without addressing the underlying infection, this natural drainage is blocked. The trapped fluids increase the pressure inside the pulp chamber, leading to intense, often unbearable pain. This situation underscores the importance of proper treatment for deep cavities, as simply filling the tooth without treating the infected pulp can lead to serious consequences and prolonged discomfort for the patient. High points in a filling, where the filled tooth sits higher than the surrounding teeth, can lead to significant pain while biting or chewing. This issue occurs in nearly 30% of filling cases and can cause discomfort if not addressed promptly. It's important to ensure that all your teeth make even contact after a filling is done. If you notice any discomfort when biting down, it's essential to report it to your dentist immediately so they can correct the problem. Your dentist can reduce the height of the filling to eliminate the high point, which not only alleviates the immediate pain, but also prevents potential complications like trauma from occlusion. Trauma from occlusion occurs when the constant pressure on the high point leads to irritation or damage to the tooth and surrounding tissues. Therefore, after getting a filling, take a moment to check whether the filled tooth is comfortably touching the opposing tooth. Any sign of discomfort should be communicated to your dentist to ensure proper adjustment and avoid future issues. Here are 3 important steps to take if you experience pain in a tooth with a filling. 1. Visit your dentist and ask them to check for any high points, especially if the filling is recent. High points can cause discomfort while biting and should be adjusted by your dentist to ensure all your teeth are making even contact. 2. If an older filling is causing pain, request an X-ray from your dentist to check for any secondary caries. Over time, gaps may develop between the filling and the tooth, allowing decay to form underneath. An X-ray can help detect this issue early. 3. If you have a deep filling and your dentist suggests a root canal treatment instead of another filling, follow their advice. Your dentist is best equipped to assess your condition, and addressing the problem with a root canal may prevent more severe pain and complications down the line. In conclusion, it's important to remember that every dental issue has a treatable solution. Whether it's adjusting a high point on a recent filling, addressing secondary caries in an older one, or opting for a root canal when necessary, these steps can alleviate pain and prevent further complications. Your dentist is trained to diagnose and recommend the best course of action for your specific situation, ensuring that you receive the appropriate care. Therefore, always trust and follow your dentist's advice. Ignoring or delaying treatment can lead to more severe problems that might be harder to resolve. By working closely with your dentist, you can maintain your oral health and keep your smile pain-free.